The operating room is full of experts. The surgeon knows the procedure. The anesthetist watches the patient's physiology. The nurses know the instruments, the medication, and the count. Yet one basic question can still disappear between them. Is this the right patient, the right operation, and the right side? They do not lack knowledge. They lack a moment that forces the knowledge to connect. We often imagine failure as ignorance. Someone did not know what to do. But modern professional failure is frequently stranger. The rule is known. The people are trained. The equipment works. Then memory is interrupted. A handoff is rushed. Two assumptions collide, and the obvious step is skipped. Expertise solves difficult problems. It does not make attention, communication, or memory unlimited. In a simple job, one skilled person may hold the whole picture. In a complex system, no one can. A modern operation, aircraft, building, or software launch depends on many specialists, tools, timings, and handoffs. Each person can be correct inside a narrow slice while the whole system is wrong. The bottleneck has moved from knowing more to coordinating what many people already know. In the Checklist Manifesto, How to Get Things Right, Atul Gawande asks what experts should do when knowledge has grown beyond any one person's ability to hold and coordinate. His answer is easy to underestimate. Write down a short set of critical checks. But the paper is not the real invention. The real invention is a disciplined pause in which a team makes the essential facts visible together. A bad checklist tries to describe the entire job. It becomes a wall of boxes, written by someone far from the work, and the expert stops seeing it. A good checklist does the opposite. It assumes judgment, skill, and adaptation will still be required. It protects only the few steps that are both easy to miss and dangerous to miss when pressure is high. The most important design choice is not the wording of the boxes, it is the pause point. Put the check too early and facts may change. Put it too late and the team can only document a mistake. The useful moment sits just before a consequential action becomes difficult to reverse. Work stops for a few seconds. The right people look at the same risk and say what must be true before they continue. The World Health Organization's surgical checklist uses 3 pause points. The first comes before anesthesia. The team confirms the patient, the procedure, the site, allergies, airway risk, blood loss risk, and whether essential equipment is ready. None of these questions is intellectually difficult. Their value comes from being asked together before sedation removes options and raises the cost of correction. The second pause comes before the incision. Team members identify themselves. They confirm the operation again. The surgeon names critical steps and unusual risks. Anesthesia shares patient-specific concerns. Nursing confirms sterility, equipment, and imaging. The team also checks whether antibiotics were given at the right time. The checklist does not perform the operation. It synchronizes the people who will. The third pause comes before the patient leaves the operating room. The team confirms what procedure was completed, whether instruments and sponges are counted, how specimens are labeled, and whether equipment problems need follow-up. Then they name the main concerns for recovery and handoff. The final pause protects against losing information precisely when attention is shifting to the next task. Notice what these pauses create. Before the checklist, the surgeon has one picture, anesthesia another, and nursing a third. After each person speaks, the room has a shared picture. A hidden allergy, missing image, difficult airway, or concern about bleeding is no longer trapped inside one person's head. The checklist is partly a memory aid. More importantly, it is a protocol for building a team on demand. Complex teams have another hazard, hierarchy. A junior nurse may see a problem but hesitate to challenge a senior surgeon in motion. A formal pause changes the social script. The nurse is not interrupting the operation. The nurse is completing the operation's required check. Introductions matter for the same reason. Once people have spoken as named team members, it becomes easier to speak again when something feels wrong. In 2009, a study reported results from 8 hospitals in 8 cities after the WHO checklist was introduced. The settings ranged from wealthy institutions to hospitals with fewer resources. Researchers compared 3,733 patients before implementation with 3,955 patients after. This was not a blinded randomized trial. It was a large before and after test of whether a simple team routine could travel across very different systems. After implementation, the reported rate of major complications fell from 11% to 7%. In-hospital deaths fell from 1.5% to 0.8%. Those are striking changes. The careful claim is that outcomes improved after the checklist was introduced in this 8-hospital study. The checklist did not make surgery simple. It made a few moments of coordination more reliable. But a before and after study cannot tell us that paper alone caused every improvement. Teams knew they were changing practice. Implementation involved teaching, local adaptation, and attention. Other conditions may also have shifted. The lesson is not that a 19-item form magically cuts harm everywhere. The lesson is that a well-timed, well-used coordination routine can change behavior in a complex system, and behavior is the mechanism that matters. That distinction became visible in Ontario. After surgical checklists were mandated across more than 100 hospitals, a large population study found no significant reduction in operative mortality or complications over the study period. This did not prove checklists are useless. It proved that requiring a form and creating a real team pause are different interventions. A box can be checked while nobody's attention, voice, or decision actually changes. Checklist theater has recognizable symptoms. The list is too long, so people race through it. Nobody owns the pause, so the work continues while words are mumbled. Items are copied from another organization, so they do not match local risks, and leaders treat speaking up as delay. The document exists, but the coordination mechanism is absent. Compliance measures paper. Safety depends on what the team actually does. To build a useful checklist, start with failure, not with the procedure manual. Ask which misstep could cause serious harm. Ask which of those steps is easy to overlook under pressure. Keep only items that can be checked at the pause point, then cut again. If every good practice is included, the critical few disappear. A checklist earns attention by being shorter than the full job and sharper than ordinary advice. Not every checklist should be used the same way. In a read-do checklist, you read one item and perform it before moving on. That fits tightly ordered tasks. In a do-confirm checklist, experts complete a block of work from skill and memory, then pause to confirm the critical items together. That fits many professional settings. The format should match the work, but both forms make verification deliberate instead of accidental. A pause also needs an owner. One person must be responsible for calling it, reading or prompting the items, and refusing to continue until the right people respond. Ownership does not mean one person carries all responsibility. It means the moment cannot dissolve into somebody else's job. The best checks are verbal and participatory. They bring eyes up, make disagreement visible, and create a clear decision to continue or stop. Now move the idea outside medicine. A product launch also joins specialists who hold different risks. Engineering knows the rollback path. Design knows what users will misunderstand. Operations knows who will support the release. Legal or security may know a condition that blocks launch. A giant project checklist will become background noise. A few shared pause points can make the hidden dependencies visible before customers discover them for you. A launch checklist might use 3 pauses. Before build completion, is there one owner, one success measure, and one unresolved blocker? Before release, is monitoring live, is rollback tested, and has the final risk owner agreed? After handoff, does support know what changed, who is on call, and when the team will review the result? The questions are ordinary. Their placement makes them powerful. The next time an expert team misses something obvious, do not begin by adding another training deck. Find the point where the work becomes hard to reverse. Ask what serious, easy-to-miss facts must be true at that moment. Give one person responsibility for calling the pause, and make the right people say the answers out loud. Expertise solves the hard problem. A good checklist protects the obvious from complexity.